Should I charge a reservation fee and should I charge a cancellation fee? I get these questions a lot. Well, look, it's really not as much about the questions. I know that's not exactly what you want to hear, but it's really a whole lot more about the situations surrounding the questions. Why are you even considering these two particular charges? And my guess is it's because you have an excessive amount of cancellations and no-shows. Well, look, I've seen this so many times, and the reality of it is that you may be trying to solve a problem that is being created upstream, and really charging the reservation fee or charging the cancellation fee is just going to compound things. Adding these two new protocols is really just going to add more things to your office manager and to your administrative team's plate, and that may not be exactly what you're trying to do. And again, the reason you're doing these things is probably because you have a whole lot of cancellations and no-shows. So let's kind of talk about that, because again, that really is probably the problem. So why do we have so many cancellations and no-shows? Well, first of all, we put patients in the wrong spot. Now, oftentimes we're scheduling patients when they have no intention of making that appointment. They come up to the front desk after a long appointment, and look, they're just trying to get out of the office. And so somebody says, well, let's get you scheduled before you leave. All they want to do is get out of the office. They have no intention of making that appointment when they leave. The second reason that we have a lot of cancellations and no-shows is just really bad verbal skills. Verifying appointments is one of the most important things that your admin team has to do, and the language and the verbal skills that they use is massively important. There's way too much to go into here. The third reason is sometimes we have the wrong person actually doing the verification. Now look, let's think about it. Who has the most to lose if the patient cancels or no-shows? By all rights, that's the person who actually should be doing the verifying. Now, I know that sometimes, it might be crazy to think that a doctor needs to do the verification process, but I can tell you, I have implemented this in certain practices where I have asked the doctor to verify a new patient appointment by actually making that call, and it cuts down the no-shows on those new patient appointments by up to 80%. Now, you think if you told your doctor that, you might at least be able to get them to listen to the idea. So think about that. We have the wrong person actually verifying the appointment. And look, let me tell you this. If you have somebody that's answering the phone and you hear this on the phone, hi, this is so-and-so, I need to cancel my appointment. And the response to that is, no problem, when would you like to come in? You have a problem. So again, language, language, language. Now look, I don't have a dog in this fight either way. So if you want to charge a cancellation fee, charge a no-show fee, that's fine. That is completely up to you. Just remember that if you're going to do that, this situation has to be handled extremely carefully. And let's take a look at a few scenarios and how you would do this. So any new patient that's coming to the office, well, this is the easiest scenario because there's really no change for that person. So that doesn't mean that your language doesn't have to be perfect, because really it does. I also recommend that this policy be written down and maybe even something that is given to a new patient or in a new patient packet. Now, patients that really aren't the reason that you're putting this new protocol into play, these are the ones that are going to be tricky because they're going to be caught in the crosshairs of a new policy that they're really not going to understand. So again, language has to be perfect. Make sure you're clear. Make sure you can answer all of the questions. And then there are those on your schedule that are actually the reason that you're putting this policy into play. And what you really have to ask yourself is, are these patients worth putting this policy into play, which is going to cause your admin team more work and more grief and cause your existing patients to ask more questions? Are these patients really even worth that problem? Once you get them to come in your office, they may be problems in other ways. Maybe you get to do the work and now collections becomes a problem on these patients. So make sure you're weighing the pros and cons, and make sure you include your team in this decision too, because they know things about this process and about your patients that you don't know. They're going to need to be able to handle questions like, Well, I've never had to do that before. Why do I have to do it now? That's the most common question that you're going to get. Next question you're going to get from patients is, well, is this actually legal? So you better have an answer for that. And then the third question you might get is, well, what if I don't want to do this? What if I don't pay it? So again, I'm not saying that the policy is a bad policy. I'm just saying that you need to make sure that you have the answers ready to be given to these patients. And the person that's delivering these answers, they better be sharp. They better have great language skills. Now, I hope this video has been helpful to you. If it has, please let us know. We'd love to hear from you.